There are many patients who come to us that they want some change in their face, or they are not liking the way they look, but they are not certain of what kind of change would look good on them or what kind of change they do actually want. While there are certain set of patients who are very specific about their needs, who know what kind of change they want on their face, what part they want to alter, but they are not certain whether alteration in that part will suit them or not. So here the role of a specialist come into play, who not only has the adequate knowledge of the facial anatomy but is also able to help and guide as to what change in your facial profile will best suit you. So hello friends, I am Dr. Diksha Dixit, plastic and cosmetic surgeon and co-founder of the Sculptor Clinic at New Delhi. And today we will talk about certain facial profiles, the differences between male and female profile, and how certain changes can bring about profound results in your facial appearances. In our various previous videos, Dr. Hina has very aptly described the facial aesthetic profiles. She has told us in previous videos that the face is divided into 3 equal proportions if we go from up to down, in upper 1/3, middle 1/3 and lower 1/3, and these should be in equal proportions so as to look aesthetic. Similarly, the face is also divided horizontally into 5 equal proportions from one ear to the other side of the ear. These have certain proportions for them to look aesthetically pleasing for a male and a female. Now let us start by telling you what are the general differences between female facial profile and a male facial profile. Generally speaking, the male has broader bones and a very muscular face, while the female have a very soft and round contoured appearance. Now if we consider the upper, middle and lower 1/3 proportions and discuss them step by step as to what are the differences in the upper 1/3, middle 1/3 and lower 1/3 of the face of a male and a female. Let's go step by step. So first we'll talk about the upper 1/3 of the face. The upper 1/3 of the face starts from the hairline and goes up to the brow. In females, they have a very smooth round contour of the forehead, but in males they have a flatter forehead and the brow ridges are more prominent. If we talk about the brows are more curved and angulated, and the distance between the brow is more in female, whereas males have a straighter brow and a heavier brow. Other difference which is very prominent between male and female is the male have frontal what you call a supraorbital bossing, which gives them a heavier looking brow and a straighter looking brow and a prominent looking brow as compared to females. If we talk about the middle 1/3 has 2 prominent features. One is the eye, the malar cheekbones and the nose. If we talk about nose, the nose in females are slender and they are very narrow and have a very sleek appearances. In males, the same nose is broader, thicker and have a more hooded appearance to give them a very masculine look. Apart from that, the middle part of the bony structure of male is more chiseled, broader and more muscular than females. But it has less fat in the cheekbone area as compared to females. The females have more cheek fat to give them a good malar high bone appearances than males. Whereas males in the middle part have a more broader and a stronger bone structure. If we come to the lower 1/3, which starts from the base of the nose and goes right up to the chin, the upper lip of the females is lengthwise smaller. The lips are more fuller and are more projected. In males, the lip is longer and they are thinner. Along with that, the side grooves on the side of the lips are more deep and more prominent in males than in females. Apart from that, sometimes females have a slender looking oval shaped look in the middle part, whereas the males have a straighter looking look. If we come to the jawline is narrower in females, whereas in males it is square shaped jawline with a prominent angle. It is more so because the jawbone is more straight, broader in males. The chin part, the females have slender, narrow chin, whereas the males have broad and long chin, which gives them a very masculine, broad look in the lower part of the face. If we talk about the neck of females is tapering and narrow and slender, whereas in males, because of the strong muscles in the neck, it gives a straight and a broad look to the neck. So these are the general differences between a female and a male profile, which gives them a feminine and a masculine look. Any alteration or deviation in any of these facial appearances might lead to a profound change in the feminine or masculine look. And more so, if the patient is looking for any kind of specific change, whether towards the feminine side or masculine side, a small change in any part of this look can give a profound change in the appearance of the patient. If you're looking for any change in a specific part of your face, or you're looking to have a more feminine or a more masculine face, you need to consult an expert who has favorable experience in this part and has complete knowledge of your facial anatomy. You need to sit with your surgeon before the surgery and tell your concerns, so that he or she is able to guide you whether a specific change will look good for your facial profile or not, and also what you are looking for, whether you will get the desired result by changing that particular part of the face, and also help you whether any additional or subsequent procedures will be required to give you a desired or a specific look. Before the surgery, it is important for you to know that these differences in male and female profile are because of the bony structure of the male and the female, the bony facial skeleton, and also because of the underlying soft tissue beneath the skin and the tissue above the bones, which is the muscle and the soft tissue part. The changes either in the soft tissue part or the bony part might be required to give you a desired look, or the changes in soft tissue and bony structure both would be required to give you a desired look, which a surgeon and an expert can better tell you. Surgery usually depends upon which part you want to cater to. It can be either changes in the soft tissue part or in the bony part. Generally speaking, surgery दो हिस्सों में divide होती है. Either we add some part to the tissue or we remove certain part from your face. The adding part is known as augmentation and the removing part is known as reduction. Both augmentation and reduction can occur in your soft tissue and your bone both, or singularly. The broad term is augmentation for adding, and for removing any part it's reduction. If we have to add anything to the soft tissue part, we either do it by adding fillers or fat from your own body. If we have to remove any soft tissue part, we call it reduction. Either we can do it by plain excision or taking out the part en masse, or we can do it by liposuction. That depends upon what part of your soft tissue is involved. If we come to the bone part, again we can add or remove a part of your bone. Adding is augmentation, which can be done either by putting foreign material, which we call as implant, which can be different types of implants, or by using part of a bone from the other part of your own body and augmenting the bone of your face. Reducing again or the removal of a bone entails either removal of a section of a bone to give you a narrow chiseled look, or by chiseling or shaving it off to remove any unwanted projections and to give you a more chiseled look. All these changes can bring about profound changes in your facial appearances. So please do consult your expert, know what kind of effect will produce what kind of result, what kind of addition or reduction you require in your face to get the desired look, and how long lasting these results you can maintain by proper post-op care and proper supervision of your expert. अगर आपको you need to know more details about any specific surgery या किसी procedure की आपको video देखनी है to have better understanding of any of the procedures, you can always write to us on our YouTube channel. You can mail us and you can also follow us on our social media handle by the name of _escalper. If you have any further queries regarding this procedure or any related procedure of plastic surgery, you can always reach out to us through our contact numbers. We will be very happy to help you. Thank you.